Welcome. Today, we'll be doing a webinar on integrating spirituality into your everyday care. My name is Jeanne. I'm an executive officer with Licensed Practical Nurses of Alberta. I'm basing my discussion today on a study out of the University of Alberta, and I want to begin by giving credit to the research team that was led by Suzette Phillips at the university. As in all we do in nursing practice, what we do is grounded in evidence-based practice, and so is integrating spirituality into our practice. That's why we'll be basing this on research that has occurred. Today, we're going to understand spirituality assessing in the context of the Alberta-based research study. We're going to apply a framework of spirituality assessment into our care. And I want to share with you and help you understand the implications of integrating spirituality into everyday care. I want to start out with a case study. There was a middle-aged man in his early 50s. He was considered to be palliative. He was admitted to the unit with weeks left. He was bedbound. He had limited use of limbs. He had a very gentle, soft-spoken voice. As I saw him, he was alone in the room. It was my responsibility as a member of the study group to approach him regarding the study, as I was part of the research team. I saw that the room was dark. The window curtains were pulled back to a gray, cloudy sky, and he was positioned to face this window looking out into the sky. I approached him. I told him a little bit about the study, and he was very thankful that somebody had asked him about that part of himself. He asked me what spirituality meant in the context of this study. We discussed it as being hope and meaning. He agreed to take part, and I supported him to sign the consent as he could. He then turned and said to me as I prepared to leave, "All I really want is to feel the sun on my face one more time." And then he gently smiled. I promised to share this with the care team, and I departed. I'll share more about this gentleman as we move along, but I left the room. I talked to the care team at the unit station, and I put it into the communication book as well. So now I just want to start to ground us in some evidence-based, and then we'll return back to that case study, and we'll discuss some other aspects of practice in this regard as well. So we started out the research with a literature review. We looked at how is spirituality defined, and for the purpose of the study, it was seen as that which gives meaning and purpose to life. So in bringing this broad definition, we found sometimes it was discussed in context of religion, sometimes in context of spirituality, but sometimes people express what brought meaning and purpose to life outside of the definitions or the words that use spirituality and religion specifically. And I'll talk a little bit more as we progress. So really it's what gives meaning and purpose, but it doesn't have to be within any predefined parameters. We know that through research that a biomedical approach tends to predominate, which means there's a focus on cure or sometimes physical-oriented outcomes and physical symptom management. We also wanted to explore what some of the spiritual issues that you would see or consistently identified by patients. Some of these were being that patients felt that spirituality was amongst the most important aspect, yet it was under-addressed in their care. They found it especially significant when dealing with end-of-life issues or chronic and serious illness. And in also dealing with any spiritual, however they define spiritual to be, suffering or stress. They found spirituality particularly important when making healthcare decisions or coping with end-of-life distress. But most often, patients are not invited to express their spiritual needs or to discuss the impact and meaning of their illness. So in continuing the review, we also learned a little bit about the healthcare perspective. There was a reluctance to explore emotional and spiritual care needs. There was questions that came forward was, how do I start the conversation? How much time will it take? They may not feel comfortable in initiating the conversation. Or if I open this conversation, how much time will it take? It becomes a little bit more of a question in how do we fit it into our day? What does it truly mean? And how do I even initiate this conversation? Some healthcare providers may not be comfortable in sitting down and discussing these aspects. So one thing we did learn is that when spiritual conversations do occur, they are often profoundly meaningful to patients and informative and rewarding for healthcare professionals. And what's interesting is I think many of us here today can reflect on a discussion or an interaction, intended or not, and maybe it just happened in a moment of time at the bedside or with somebody that we're caring for, that a profoundly spiritual conversation or moment did occur. Spiritual screening and assessment tools, as we do with many other assessments in nursing, can provide a means of engaging patients in spiritual conversations. It helps to explore the value of including spiritual screening in clinical practice, and our research aimed to strive to answer that. We wanted to also determine the ways that healthcare professionals could incorporate spiritual screening into routine patient care. So it's not just asking the questions, it's actually responding to what kind of feedback you're getting and incorporating into their care, just as we would incorporate other interventions. And it's also to identify facilitators and challenges or barriers to incorporating spirituality into person-centered care. In the study, there was 3 different phases. The first phase had to do with recruiting and educating healthcare professionals to learn the spiritual assessment tool. The next phase had to do with recruiting patients and included also collecting the data that we learned. Phase 3 had to do with data analysis. So from what we learned, bringing back the data and seeing what the research has presented. This study happened on 3 inpatient hospital units in Alberta. 2 of them were palliative focused units and 1 a geriatric assessment unit. There was a variance in the population, but it'll give you a little bit of a sense. There's an age range from 53 to 92, so you can see that that's quite diverse. Some had metastatic cancer, or they were admitted with pain or weakness, dementia, falls, injury, gastrointestinal concerns or COPD. Some were admitted with rehabilitation needs or other types of illnesses. And the healthcare providers that helped us with this study in actually doing the spiritual intervention and assessment, there was 9 that were included, and it was an interprofessional group. So there's nurse practitioners, occupational therapists, physiotherapists, physicians, nurses, and social workers, and their age range was approximately 30 to 59 years old. Now, the tool that we taught them in that phase 1 training was called the FICA Tool. It uses an acronym to guide you through the question process. Now, this was chosen just as a framework to begin the discussion, but we did find as healthcare providers became a little more comfortable in the conversation, they made it a little more formal, but some of them felt it was nice to be grounded in a strong assessment tool. And the focus of this study wasn't to see what assessment tool worked the best. It was really to see if we did some sort of assessment in spirituality, what kind of impact can we have in the patient's and family's experience. So this study used this spiritual assessment tool to be used by the healthcare providers in assessing spirituality in the project participants, or for those patients that consented and wanted to be a part of this study. This tool, it's called the FICA, as I mentioned, is based on 4 areas of exploration, and it asks exploratory questions. So the F means, what is your faith or belief? Or do you consider yourself spiritual or religious? And know that some people may not respond or didn't want to respond necessarily to religion because they may not consider themselves religious. Some of them would understand the context of spirituality, but some asked questions like, what exactly does that mean? So sometimes this was rephrased to just explore what gives meaning, what gives hope to you. So it's however that would fit in the conversation that you were having. The I was exploring about how important that aspect is in their life. So what influence does it have on how you take care of yourself? How have your beliefs that you shared influenced your behavior during your illness? Or maybe not a focus on behavior, but just influence your experience during your illness. And what role does some of these things play in your health? The C is for community. So what influence does this have on you or the group of people that you really love, who are really important to you? Do you have a community that's a great support to you? And how do they support you? Now, we might see community is defined as many different aspects, and it's about allowing the patient to define spirituality or faith or belief or community the way they see it, not necessarily our perception of what that is. So that's why it's important to keep an exploratory focus in this. For A, that is one of the most important questions you're going to ask, and it's address. So now we're asking, okay, you've shared what's really important to you and what brings you meaning, and you've told me how this brings importance to you. You've told me about any community or family that's a part of this. Now in A, we're going to ask, how would you like me, your healthcare provider, to address these issues in your healthcare? Or maybe it's, how would you like me to integrate it in your healthcare? Or, you know, now that you've told me this, what can we do as a care team to integrate this into your everyday? So it's really, we use the language that fits for the moment, but we're taking the time to ask the questions and looking at integrating maybe a different type of intervention into their everyday care. So we learned that there was different interventions that were offered by the interprofessional team members. So the healthcare professionals felt that these were some of the interventions that they included. They said, you know, we do a lot of supportive listening and providing emotional support. We do some engaging with family and facilitating patient expression through different ways. But the study revealed some of the spiritual issues that were identified by both the patients and the healthcare professionals. They felt that there was also a need to be empowered, to be courageous, to find where there's hope and meaning in suffering that they're experiencing. They also found that there was a need to explore grieving and anxiety. The patients sometimes had a sense of being completely overwhelmed by the suffering they were experiencing and having an uncertainty about the ability to endure. Some had difficulty expressing feelings about the situations. Some expressed guilt, concerns about grief, and difficulty reflecting on some of the joys and the hopes and the values. There was overshadowing by the illness that they were experiencing. Patients said that they were concerned regarding how significant others or people that they loved for were coping with the illness and with the loss, how it would affect them. They were coming to acceptance of their own illness and their own experience and their own mortality. Some expressed a fear of dying. Some felt that they were abandoned by God, and some came out and identified a religious or a spiritual struggle. So our study also identified what the healthcare professionals thought as spiritual interventions, as noted there on the screen. And they mentioned referring to spiritual care professionals, and I just want to bring to this that yes, that's absolutely important. And bringing this part to the assessment, assessing spirituality is very important, and we have to learn when a referral to spiritual care is required, but it's also not required in just a spiritual conversation that we can integrate into our everyday care. The healthcare professionals also found it sometimes difficult to explore some issues related to bereavement and loss. But they did feel comfortable with active listening and emotional support. That was part of their everyday care. They felt it was important to acknowledge the family and importance in the patient's life. They used activity and exercise and humor in helping them to move through some of these interventions. So in this study, we also looked at what the strengths were in integrating an intervention to explore spirituality. And we looked at it at different levels. We looked at it from the overall organization. And we saw that there was alignment with the mission and vision and values of the institution and what their goals and focus were. The leaders and the staff aligned well with this mission, vision, and values. At the unit level, the organization employed spiritual care professionals to offer support to patients and staff, and some clinical leaders could attend to and they could role model ways to include spiritual components into care, and they started to see that it wasn't just the role of the spiritual care professional on the staff. At a personal and professional level, so this is with the healthcare professionals, they felt very committed to a person-centered approach to care that inherently viewed spirituality as essential. And we know in our training and in our education, holistic assessments is very, very important. The healthcare professionals recognize the importance of getting to know and establishing and maintaining trust and moving forth with a holistic assessment that included spirituality as well. Healthcare professionals were aware of expected and actual professional competencies regarding spirituality. So reflecting back on that holistic aspect, we know that as healthcare professionals, many of us took that, and likely all of us took that in our education as a requirement of assessments. And using a spiritual screening tool just supported further development of competencies in this area, because these conversations don't necessarily flow as naturally or as comfortable with everybody. What we found at the patient level is that they felt, and this is the patients and the family, that spirituality is an absolute essential component of care. They desire to have their spiritual issues addressed and integrated into their care. It allowed the patients to share their spiritual perspective, and that enhanced the patient comfort level with the healthcare professionals. These spiritual discussions, or discussions of meaning or hope, whatever it was in the context of the moment that you had the discussion, it provided an opportunity for the patients to reflect upon how they feel as related to their illness and what they were experiencing. There was some challenges in this study in incorporating spirituality assessment into care. At the organization level, there was a need to develop like a formal way to follow up on some of these interventions. So if we do the assessment and we integrate it as a component to care and just say, okay, this is what we've determined we can do, it's as an organization, we have to make sure that those interventions and what we determined as a need continues with that continuity of care, or a transfer to a different level or to a different organization. There was also an express that it's difficult to attend spiritual needs of acutely ill and cognitively comprised patients. And I know we had discussions on how exactly do you do something like this, or do some sort of assessment with somebody with dementia. Well, we know that determining or trying to learn what's important or meaningful to a patient doesn't necessarily mean having a conversation, as we don't all have the ability to do so, and we might not see that ability in clients with dementia. But what we can do is, just as we do in our everyday care, we have a sense of what brings joy or meaning, or the smile, or that soft touch, or a different expression. So I know as nurses, we express ourselves in different ways, and we're very attuned to how our patients express themselves as well. This is just part of a different way of speaking and having a language to help connect with them. With the challenges, there was also a pressure in the healthcare providers and of the system and the unit. There's a pressure to discharge and transfer patients prior to consideration of spiritual concerns. Many of these decisions tend to be based on physical, but if there's some spiritual distress or concerns in that area, there may be a challenge that the discharge still needs to occur. How do we ensure some of those care needs are still met? And are they stable enough even in this area to do the transfer? There's that, and I guess overall, just bringing that forward, is the challenge is there's still a strong emphasis on the medical model. At the clinical level, they found that there was competing priorities. We know as a nurse, our day is filled with tasks. And sometimes they felt that it was really hard to incorporate spirituality into patient care. Many felt that we just had to stop what we were doing and saying, okay, I'm going to stop and do this specific spirituality discussion. But what they learned is sometimes it's just threaded through the care you provide every day. There was competing clinical demands. So physical care needs tend to take precedence over spiritual care needs. There's an expression that addressing these concerns takes time, that documenting and communicating patients' spiritual needs to other team members is challenging. And professionally, we learned that some of the healthcare providers said knowing how to attend to their own spiritual needs, or their own definition of spirituality, or their own possible spiritual distress can be a challenge. If they don't define it themselves, it might be difficult to help a patient find meaning, or meaning of this within their lives. But as a healthcare professional, we know it's very important. It's not about our definition of these things. It's about what the patient sees to be important to them and bring meaning to them. So as a healthcare provider, I might see it or define it within my own life as religion-based, maybe, just for an example. But know that maybe that patient isn't religious. So I'm allowing them to define it within their own context. And I know we had one patient that defined it as physical activity. That's really what brought in meaning. So in that, there was a physical therapist that could connect with him on a different level. Sometimes it's incorporating those everyday things and allowing them to express what's important and not having those things predefined. That allows that exploration, and we can really connect differently and really meet the needs of the patient. There was questions about the healthcare providers. What is my professional role? Am I not violating some boundary? Well, it's asking what brings meaning and hope to somebody. It's only a violation of boundaries if we're moving our thoughts or our ideas onto our patient's care or into their perception of what's happening. Asking them what's important, what gives you meaning. How can I put this into your care every day? A lot of the times we ask some of these things. It's just incorporating them intentionally to make a difference. Sometimes the healthcare professionals had fear that their attempts to address some of these issues would lead into areas where they felt very unprepared or maybe very uncomfortable. And sometimes there was language barriers. So it became challenging to do like a formal spiritual assessment. So they had to modify their language to meet the needs. And at the patient level, some of the barriers were that conceptualization of spirituality. I know in my experience, I expressed to one of the patients, I talked to him about spirituality, and he said, but I'm not religious. I said, okay. We look at spirituality as bringing hope and meaning. Is there something? And he said, oh, yes. So it's just about having that discussion. Sometimes patients just said that they weren't spiritual. And sometimes right there in the moment, the conversation stops. We don't know what their experience is, but it doesn't mean that we have to stop the conversation. It means that maybe we come back at another time and we word it in a better way. Okay, what can I do today to make a difference? We saw a lot of opportunities at different levels with integrating spirituality into care. So more of an intentional inclusion, as I mentioned, many of us do it every day in our care, but being very intentional to be attuned to this holistic sense and assessing spirituality. They felt a collaboration between clinicians and researchers. They were learning new ways to incorporate aspects into their care. At the clinical level or the unit level, it enhanced patient and family satisfaction as well as healthcare professional satisfaction. Patients and families started to perceive the interprofessional team as being more attentive and more respectful to the patient as a person, rather than focusing on those physical symptoms and just managing those physical symptoms. They felt increased professional satisfaction of the healthcare professionals. They felt that there was a continuity and attention of spiritual issues with admission and along the care continuum. So they would do this assessment and then they would integrate it into the care. So they really felt that they were actually integrating this every day. They started to enhance their documentation, and they used that FICA structure to do the documentation because they felt, how do you document a conversation like this? But they used that as a guideline. Healthcare professionals felt increased job satisfaction. They felt that they were meeting the patient's needs. We had a nurse that said that it gave her an absolute renewed sense of purpose within her profession. It brought her back to why she entered the profession in the first place. They felt enhanced in their role and validated in their role. The healthcare professionals felt greater self-awareness in the areas of spirituality and allowing their patients to express the spirituality in the way they needed. They found opportunity to improve communication in the team and how to be empathetic and incorporate that into the care. They felt that the patient experience was enhanced and they were providing holistic care. The patients said it enhanced their experience, that they felt spiritual growth and enhancement, that they had a greater sense of being treated with dignity and with respect. They felt that their family perspectives were respected. It supported how the patient coped with the current situation and their transitions. They were able to share and draw on personal spiritual resources. We found that they would identify any existential or spiritual suffering, and it allowed an opportunity to identify them and reduce some of the suffering and support. And it also helped to explore what additional spiritual resources are out there, even community-based, or what's on the unit. What kind of specialization do we even have in our team that can help support? So with our study, it also brought recommendations. At an organizational level, we suggested investigate ways to integrate the mission and the vision of the organization in practical ways. So for continuity of care, we suggested to develop strategies to ensure those needs and spiritual needs are routinely assessed and addressed. We also indicated this also being a discharge or a transfer priority, just as physical symptoms often are. So consider spiritual and psychosocial issues along with those physical needs as determinants for discharge or transfer. We said at the unit or the clinical level, we recommended that it broaden the awareness of spirituality in the interprofessional teams. It's an essential component of care. Enhance team communications around spiritual issues. As we know, there tends to often be a focus on the physical. And educate and equip the healthcare providers to develop their scope of practice and their competency, and also allow them on the units to explore competencies and growth in this area. For professional level, mostly the healthcare providers, there's a huge opportunity here for education. So as I said, there's not one way to integrate spirituality or whatever they define that to be into their care. There's many different ways, and we've shared with you today just one, but there's many different ways. There's maybe a good time for it and a bad time for it. So it's exploring what that timing is. We all know in nursing that sometimes things happen in a moment. So we can take that moment. But sometimes there's points in the illness trajectory when spiritual needs can optimally be addressed. So we suggested exploring that and integrating that. For time management, to facilitate an understanding that time for spiritual screening enables efficient patient care. It's very significant. So with our meds and with our dressings and with the other care we provide, this also needs to be incorporated and accepted as a point of time management. The professional boundaries with the patients, there was a lot of discussion in that, and I know that I've had discussions with other nurses around this, and that's a point of education as well. So we really have to protect ourselves, and we know we have our code of ethics and our standards of practice, we can't impose our values and beliefs onto our patients. So we really have to be aware of those professional boundaries. Remember, it's assessing them and their concept and their need. When it came to ethical distress, we recommended enhanced opportunities for healthcare providers to receive supportive intervention in distressing cases and scenarios. We know some cases are very difficult, and we too need to self-reflect and take care of ourselves. And we also recommended to involve family in this spiritual history taking. Now, I want to take us back to the patient participant. When I returned to the unit to follow up on the study, I learned that through the narrative notes, much had occurred since my last visit. The team read my communications, and the nurse, when completing the spiritual assessment, arranged for the patient to be transferred to a wheelchair so they could go to a rooftop garden. They were going to discuss the assessment further. She bundled him up as the sky was a bit dreary, and they headed to the rooftop garden. As they passed through the doors, a few raindrops had fallen and the patient began to cry. The nurse was startled and pulled back. She thought it was too cold. A smile spread across the patient's face, and he told the nurse that he could feel God's tears. The nurse then sat with him and talked. She used the spiritual assessment as a guide, but she let him talk about what he felt about this moment and moments to come. She opened up that discussion for him. Further charting reflected that the family felt so pleased with how their sibling was being cared for as they continued, or the team continued, to support his requests to include aspects of spirituality in his care, such as taking the time to transfer him so the family could take him outside. They arranged time to go to the hospital chapel and have spiritual care visit as well. What was most important is that his spiritual self was nurtured every day, not just by spiritual care and not just through chapel. Staff ensured that he had open windows, sunshine, and that he had holistic care in his last days. This I share with you is only one example of many. So using a spiritual screening tool into routine care, we know it can ensure that spiritual conversations occur. It provides a framework to start that conversation. Some staff may choose not to use such a framework and bring it into a more informal conversation. It just guides that conversation, and it can also guide documentation of spiritual issues. And it can change the way you care. So the nurse on one of the units, she was ready to leave her work before this study. She said she was burnt out. She found she was increasingly exhausted with less energy at the end of the day to care. She felt that she wasn't caring and nursing like she used to. This is the nurse that took the patient to the rooftop, and she's the nurse that engaged in the discussion about spirituality. She shared with us that she realized that this was more than just a series of assessment questions. She connected with the patient differently that day, and she began to integrate this into more than just this patient that was involved into the study. She started to do it every day with all the patients that she cared for. It started to shift her perspective about her ability to care. She said that she was beginning to gain back energy and passion for her profession again. It brought back to her the feelings that she had when she first started nursing. She was amazed that she could feel her passion again. She said she thought it was gone. She felt like she was making a difference. So I just want all of us to just stop and reflect on our experience and in our assessments that we've done and in our interactions with our patients. and just the impact of the quality of care of those conversations and holistic nursing in integrating an intentional spirituality assessment or conversation into your care. It can enhance your practice competencies, as well as looking at educational strategies to share some of this research. I bring this to you because I felt in my experience, this is something that could change the way we care as nurses. I wanted to help you translate this into the practice setting as everybody did on the research team. Knowing all of these things that we've learned can bring a significant impact. What I wanted to bring to you is I mentioned that the study is derived from the University of Alberta, and I wanted to give you the contact information of the lead for this study, and this is Susan Vermont-Phillips. Please feel free to connect if you have any questions about this study, and if you have any questions about competency as related to spiritual care assessments or having some of those conversations, we do have our competency profile online, and please know that you can contact us in our practice area. I want to thank you for joining me today in sharing how we can integrate spirituality into care.